Stephanie Meyer, and I'll be presenting Social Justice: Has Nursing Lost Its Way? Beckmeyer and Butterfield propose in Unreconciled Inconsistencies that nursing has lost its way in terms of social justice. I completely agree with them. We need to return to social justice because in every generation it has had its struggles when it comes to healthcare. Specific reforms from the late 1800s are mentioned in this article, and it is explained that they exceeded expectations because they moved away from one-to-one nursing care. Yes, our current struggles are not the same from those in the late 1800s. That is because healthcare is always changing, evolving, and in need of refinement. There is never a time to abandon healthcare reform. Social justice is a core value as a nurse. As nurses, we remember that there is more to health than healthcare. As nurses, we're trained to think small and to just think of the patient in front of us. If we do limit our sight in this way, we will miss out on opportunities for real and impactful change. Think of healthcare as a tree. By thinking small and simply treating the individual while treating the branches of the problem. To get to the root of the problem that has brought the branches in to see us in the first place, we must address the system that caused the roots, or the population in general, to be ill. Corporations benefit from treating the branches. Sick America means full bank accounts for them. As nurses, if we're not actively seeking to treat the root of the problem, we're helping the corporations earn more money, in turn keep the roots sick. Listening for Prophetic Voices in Medicine by Paul Farmer. In this source, Paul Farmer explains that social inequalities come on small and large scales. Farmer has a great philosophy to think globally, act locally. This supports Beckheimer and Butterfield's claim that nurses need to do more in the realm of social justice. We must go beyond of being aware of what's going on. We need to take action. He tells of a 9-year-old boy diagnosed with tuberculosis. Even though drug therapy exists to cure one from tuberculosis, it remains a top killer, especially to the poor since they lack access to health care. This boy was given proper treatment and recovered beautifully, which is awesome. But what about the millions that don't share the same fate? This is a prime example of treating the branches, not the root. He point blank illustrates the same idea that Beckmeyer and Butterfield make about large corporations. They revel in illness since it increases their profits and the individual's salaries. Social injustices and inequalities are far from their agendas. We're given a call to action by Farmer to see the suffering around us and to do something about it. These inequalities could be the focus of our collective action as morally engaged members of a healing profession. The textbook Philosophies and Theories for Advanced Practice Nursing. Butts and Rich present the idea that humans are the ones that create social injustice. But on the flip side, we're also the ones to fix them and to shape a future that is better. It is posed that fundamental goal of nursing is to bring about maximum health and well-being for the individual, family, and community. To do this, we must be constantly vigilant in identifying circumstances that need improvement. This comes back to Farmer's idea to think globally, act locally. The majority of us work closely with the individual, but it takes letting the individual be the passageway to see what's going on a larger scale. Once we see what injustices are occurring, we not only have the ability, but the duty to make a change. Since humans are the creators of the injustices, we must be the destroyers and then the creators of something even better. All right, in conclusion, we all came into nursing with the reason to help people. Yes, we may have envisioned doing this simply through bedside care, the one-on-one, individualized care. However, if we don't become proactive in social justice, our ability to effectively care at the bedside will be lost through our fingertips. I'm not saying being at the bedside is a deterrent from improving social justice. Actually, quite opposite. It is the key to be able to do something greater. By being at the bedside, we intimately know what's going on with the community. We can take action because we have the knowledge, and we have the education which helps us. We can work to overcome the social injustices that brought our patients into us in the first place. It is because we're at the bedside and we have been educated on social deterrence that we have a unique perspective which compels us to do more. As Beckmeyer and Butterfield says, it is indeed a privilege and a burden that has given us the ability to make a real and lasting change. And these are my references. Thank you so much for watching.